Good morning, everybody. If you remember, not too long ago, we have Dr. Jaya here talking about all the typical symptoms of menopause and what we should do. I managed to get this busy lady back again, so don't go away. We're going to talk about HRT. Hang on. Good morning, Dr. Jaya. How are you?
Hi, good morning, Karen. I'm good. And how are you?
I'm good. Busy as usual. And thank you again for, I know you have a busy schedule, and this recording just for our audience is at 7 a.m. in the morning because she is a in-demand doctor, super busy, and she's given us some of her time to do this. So just to follow up from our last conversation, Dr. Jai, we talked a lot about identifying all the problems that come with it. And both of us are really passionate about getting women to do something and not just sit back and say, okay, this is what our bodies are going to do, and just resign to the pains and all those things. And I have to tell you, the journey I am going through is not been easy because there's a lot of resistance from women, and they're not willing or not open to the fact that there's hope and there's actually help for menopausal women. So we're going to talk about one of these help that we are talking about, and this is called hormone replacement therapy. And I'd like you to educate our ladies about this.
Okay. Thanks, Karen. So just to look at things from a wider perspective, why is it women in Malaysia resist looking for help or asking for help? And they're kind of resigned to, okay, I'm aging and this is a natural cause. There's nothing wrong with it. There's actually nothing wrong if you're accepting of whatever is going on. You're not troubled by any symptoms. That's fine. But about 80% of women will suffer at the transition point. And the commonest symptom being, as we discussed the last time around, is hot flashes.
Yes.
A lot of other things come along. But the thing is, women think that it's only hot flashes and menstrual irregularities that comes with menopause. Women respond differently. Some get very anxious and they're wondering, why is it I'm getting very worried? I just don't feel like my natural self. Right? So women have been basically, for lack of a better word, marinating in estrogen from the time we hit puberty. All the cells they're bathed in estrogen. So we are hitting natural, we're talking about natural menopause here.
Right.
So menopause, the levels of estrogen starts dropping, right? It's like dropping a feather, and the feather suddenly comes down. Right? As opposed to women who go through surgical menopause or chemotherapy, it's a sudden drop. So that's very, very different. These women definitely need more help. Okay? Because if we hit menopause earlier, a lot of other problems come along, like bone issues, heart issues, right? So now we have menopausal hormone therapy or hormone replacement therapy in many forms. The reason why women are generally averse to it is the fear of cancer. We all know that in the early 2000s, about 20 years ago, there was this study which came out saying that, you'll get breast cancer at higher risk. But now, newer research has debunked all these findings. So our aim here, you and me, Karen, is to actually get that information out who are facing midlife issues, to empower them with knowledge so that they seek help or they go have a discussion with their regular doctor to see what can be done. So after you weigh all the information possible, and of course we tend to lean towards Google quite a bit as well, and now you type in the question on ChatGPT.
Google, yes.
ChatGPT will give you a lot of answers as well.
Yeah.
You weigh the decision and make your decision from the angle of strength, because you're empowered, you know what you're doing.
That's right.
So so that's basically what it's about. So now, as you asked about hormone replacement therapy, it has been proven to have a lot of benefits. The hot flashes that you get, the troubled sleep, the night sleeps, the anger, all those things, right? They will generally disappear within a week. Depending on the dosage you take, it will be cut down significantly, and suddenly you feel very renewed. So that's a given, the vasomotor symptoms, the sweating and the flashes and things like that. But hormone replacement therapy is not only for that. There are a lot of other benefits. But caveat here is all this research is based on Western population.
Sure. Yeah.
We do not have research based on our population.
Right. The Asian
Asian population, it is lacking in that department.
Right.
So, and we all know that we are nowhere near the Caucasians.
Yeah.
Right? And our genes and the environment that we are exposed to, the pollutants that we are exposed to, is very different. The food we eat.
That's right. Yeah.
We're just like using that as a baseline to remember that it's done in a different population.
Correct.
So aside from your hot flashes, that others will say, hey, it will go away after 5 years. Well, you're willing to endure that at max of 5-7 years, that's fine. But that's not the end of menopause that's only at the point of menopause transition.
Yeah.
Over time, chronic deprivation of estrogen will lead to a lot of other problems.
That's right.
Hormone replacement therapy, or MHT, menopause hormone therapy, can help alleviate. For instance, the bladder issues will set in, vaginal dryness, we spoke about that the other day.
Right.
And this is going to get from bad to worse.
Yeah.
It's not going to improve in any way. It's not going to be like the hot flashes, which will go away. It's just going to get from bad to worse.
Yeah.
And the other part of it will be bone issues.
Correct.
Yeah. Women live a lot longer now, so we don't want our spine, our vertebrae fractures. We don't want our hip bone to fracture, or long bones.
Yes.
So because we're living a lot longer, the bone health becomes the issue. Of course, many women go through life without having a fracture, but if you are at risk, then you should seriously consider talking to your doctor about it. Correct. So who are those at risk? Okay, not every one of us. Those who are very small built, meaning low body mass.
Yeah.
Ladies, they are at risk. Okay? Or those who have a family history of fractures. These women are also at risk. See? And others who are long-term steroid therapy. So these are some of the factors that will actually affect your bone health. And of course, lifestyle change issues, smoking, alcohol, those kind of things, right? Yeah. In this group, they should seek counseling from their doctor to see what can be done. Because it's very debilitating to have a fracture at old age. So that's one. Another one would be for heart health.
Yes.
Heart health, yeah. Especially if you start within 5 years of menopause, you start hormone replacement therapy. It's been proven to prevent heart disease. Yeah. So what women after menopause have a big issue with heart disease.
Yeah, I want to interject here because I want to share with you. I actually lost a friend who and it was so sudden, and it was truly unexpected. And I think that's what you and I are trying to do here today is the women out there, please listen. The transition may take, as Dr. Jaya has said, 3-5 years, and maybe you think that's it. But the ongoing depletion of nutrients that is going on to your body from your bone and your heart and then your bladder, that is going to go on. So do something, whether you choose on a natural path or hormone replacement. We are not here to advocate one or the other. We're just giving you information so that the more information you can take options to find out what are the things that works for your body best. That's our mission here, because we are both extremely passionate to get women on board to say, hey, time to take care. And we are still young. We still have easily 20-30 years to live. Just because we are 50, we are not halfway down under anymore, So that is what we're trying to do here, audience. Yeah. So I love talking to you because you are so straightforward and you are honest about what it can do and what it cannot do. Perhaps just share with us some of the risks that the most common that people keep thinking about? That's number one, and also the benefits.
Okay. So as for the risk, the biggest risk that women fear is breast cancer. They fear that when you take hormone replacement therapy, you will end up with breast cancer. But if you look at it from the other point of view, very few, in fact, the vast majority of women who get breast cancer have not taken hormone replacement therapy at all, right? And if you look at the Malaysian context, yes, the number of women who get cancer less than 50 is slowly rising, but still that does not match up with the number of women who get breast cancer in their menopausal years. So that begs the question that if I'm menopausal, I'm already estrogen depleted, why am I getting breast cancer? So there are actually a lot of other factors in play, right? So that's one, breast cancer. Probably it's a bit blown up. Again, the vast majority of women who take hormone replacement therapy do not end up with breast cancer. Perhaps we are more vigilant. We go for more mammograms. We screen, right? And if you happen to get breast cancer whilst you're on hormone replacement therapy, treatment is initiated early, and the prognosis is very good.
Yeah.
Okay. So that's breast cancer, which is a very big thing women fear. Right. Then there are other cancers that can happen, like womb cancer, the lining of the womb. But that again depends on the type of hormone replacement therapy you take. So estrogen gives us all this nice, good feeling, right? And progesterone gives you a kind of tenderness, the bloatedness. But if you happen to have a womb in you still, you need to take both. So that would prevent the formation of womb lining cancer. But if you have removed your womb for any one reason, even womb cancer, womb lining or the womb cancer, it's fine to take pure estrogen. You don't need a protective thing anymore. So that's womb cancer. But the biggest thing in the at the back of women's mind is breast cancer. So I would strongly suggest that you have a chat with your doctor because the risks are different. If you have a family history of breast cancer, say your sister or your mother has breast cancer, your risk of developing breast cancer on hormone replacement therapy is twice that of a woman who does not have a family history.
Yeah.
So you have to discuss that. Then there are other issues that women worry about, like say clots. You develop clots in your leg, get deep vein thrombosis, or if the clot migrates to your lung, things like that. That clots tend to happen more if you take hormone replacement therapy via the oral route, tablets. But now we have gels and creams, and we even have vaginal rings which release estrogen. So those things, those other modalities, because it does not go through your system, it does not go through your liver to be broken down, it reduces the risk of clots remarkably.
Okay. Yeah, I mean that's the thing. Time has given improvements in this, and that there's so many other things. But I do also still have the concern that it's just not done enough studies for more Asian women. It's all very catered for the Caucasian women. So yeah, and that's where again we are not advocating anything HRT or likewise. It's just that it's options, and you should talk to your health practitioner and make sure that it suits your body. And of course, then there's the benefits, right?
The benefits are a lot, actually. The main ones would be the symptoms that you're having, the hot flashes, the low mood, insomnia. Those things will go away within a week or more, right? It's very fast. And studies, again, done on Western population, when you take herbs, St. John's wort, all these other things, including TCM, it takes up to 40 weeks before it kind of tapers down, but it does not disappear as fast as hormone replacement therapy. So that's temporary measure. We are more interested in long-term measures. We want good bones. We want good bones. So hormone replacement therapy has been proven to be the best. Okay. The caveat is, which you must discuss with your doctor again, is when you stop hormone replacement therapy, the risk will come back after 5 years, the bone risk. It will catch up with whatever you've stop. So if you've taken a hormone replacement therapy just for a couple of years to get over the hot flashes, that's not going to protect your bones long.
Correct.
And heart protective, yes. If you start within 5 years or 10 years of menopause, still time to prevent heart disease.
Yeah. Okay.
The other one which troubles women a lot is the vaginal and bladder issues.
I hear too often the same problems.
The vaginal dryness gets from bad to worse. The vaginal mucosa or the lining of the vagina gets thinner, and as you age, it gets even drier. And the good bacteria that grows in the vagina, it gets altered,
right?
And then it's easier to get infections
Yes.
and itchiness and things like that.
Yeah.
So that too, hormone replacement therapy would help. If you are not keen on taking hormone replacement therapy for the whole body, there are creams vaginal creams, meaning hormone creams that you can be applied inside.
Right. Okay. So, you are more medical based. For me, we talked about this. I've always preferred a more plant-based approach due to my health reasons and all. And it is something that, again, just to put it out there for the audience, is that whatever route you do, check with your health practitioner. Make sure that you do the best for your body. Listen to your body and see what is trying to tell you. That is super important. But do something, because whether it's HRT or a plant-based solution, it is for sure. Plant-based will take longer. That's normal, because it's just slowly allowing your body to heal and come to a stage that you are comfortable with. But of course, hormone replacement, the effects will be a little faster. But then there's again that if you choose to wean off it, there will be as well some effects out of that. So you need to balance out and make those decisions. And I also want to quickly touch base on women who are going through chemotherapy and surgical hysterectomy, is that when there's that immediate drop in estrogen and all, maybe look at all the options from your doctors, because especially for young women, in one of my recording, I talked to a doctor who's a breast surgeon, and she says that as you said, breast cancer is now very treatable. It's not as scary as it used to be, and that when you do chemo, you do lose all your sexual desires, your vaginal dryness, and things like that. And this is where you have to also look at how you can improve your health, because a lot of young women are getting cancer, and a bit too young to that I would like to say, and that's where, but you still got a lot of time to live for, so you need to take care of this and make sure that your relationships are still maintained with intimacy with your spouse and partners, and so to end this, in terms of HRT, what are if I'm really interested, what are the first things that you would advise, besides going to the doctor? What are the few questions that I should ask?
Okay, Sharon, the current recommendation for HRT does not cover a lot of other things that we desire. The recommendations would primarily be for those symptoms, those very bad symptoms we get during the transition.
Okay.
And it has to be given within the first 5 to 10 years of menopause, not later.
Okay.
Not later.
Okay.
And, also for bone health, women who are at risk of fracture. So women who are not at risk of fracture, there's no reason to take HRT according to the current guidelines and recommendation.
Okay.
So questions to actually think about would be, you honestly need to have an honest conversation with your doctor, and the history, your risk profile has looked into, and from there an option formulated. You don't have to take it. You can try it. You don't like it, you can stop any point in time. Right. So a lot of it has to be basically a counseling session, which will take time. It will take easily 45 minutes.
Yeah.
It's not going to get fast.
Yeah.
As you mentioned about plant-based, right? Traditionally, it would be soya bean that the Eastern population takes a lot. But there are a lot of other plant-based phytoestrogen
Yes.
that we consume, but no two women would be able to absorb the estrogen, the phytoestrogen
Yeah.
equally.
Correct.
And that's because of the gut microbiomes, the bacteria, the good bacteria that we have in our gut, that we affect. Again, we don't have studies on what our gut microbiome of the Malaysian woman is, working on a study in the near future. And that would actually tell you why some people derive all the benefits and others don't.
Yeah. I mean that's the thing. And I and there's no one solution fits all
Yeah.
kind of thing, isn't it? Whether it's HRT or plant based, but it is at least trying and then finding also add on to improving your diet, your exercise, all these combination to give yourself the best chance of having this transition better, improve your general health for your old age. And that's
Yes.
what, because I just want to share, losing a friend out of the blue like that is shocking. It's shocking because because we get so caught up with work, we get so caught up with everything else, but not
Yes.
listening to what we have.
No, the reason being, one of the reasons why women don't seek help for their heart health is because we don't have the same symptoms as men do. Men have that classic, chest pain, radiating. Women don't manifest with that,
Okay.
especially those who are just past menopause or about 50 plus. So they do not realize they're having symptoms. So as I said, lifestyle changes, very important, very important. Go for your regular checkups. Try to pick things up as early as possible.
Just quickly before we go, what are the symptoms that we should look out if it's for the heart for ladies? Because you say men have that, the chest gripping thing. What about for women? What are the things to
I mean, women can have the same symptoms, but other symptoms that they have can just present as simple as indigestion kind of symptoms.
Oh, okay.
You feel that as air in, it's not as classic as men, especially in premenopausal women
Okay.
or women about 50 or so. That's why it gets missed. So I would advocate going for annual checks.
Yeah. Okay. Last question for you. If we were to do a live session, would you be open to it? And that the audience can actually ask you questions and do something. At least for those who are really shy, they can type in and I'll read out the question.
Sure. We are here to advocate for health for women in midlife.
Okay. Thank you so much. I know you have to do your rounds already. So have a wonderful weekend ahead and we'll keep in touch.
Thank you.
Thank you. Bye.